Thank you for inviting me to be part of your celebration in Bangladesh this month, September 2014. I want to especially thank Mr. Hag for inviting me from the ICA, the International Caregivers Association, which is a home office located in the United States of America. However, the ICA is represented throughout all regions of the world. It's with great pleasure that Mr. Hag is representing Bangladesh. And I want to also welcome all the celebrities and invited guests at this celebration this month in Bangladesh. It is wonderful to see such activities and such efforts being made for Alzheimer's and for the families and also for those living with Alzheimer's. The ICA was being planned for several years. However, it just opened this year in 2014 in June. And let me just read a statement for you to inform you of what it is about and what we can do for Bangladesh. The International Caregivers Association, the ICA, recognizes the need for research and fundraising efforts for Alzheimer's to possibly find one cause and one cure. However, it also recognizes the disproportion of funds allocated to research and when compared to the need for care and facilities for those individuals and for those families. First, a well-trained healthcare workforce is equipped to save time, improve the life of individuals living with Alzheimer's, and reduce the high cost of burnout of individuals, either family members or professionals. Second, forming interprofessional healthcare teams help to reduce time, cost, and energy of every person on the team. It also increases the quality of dementia care and the quality of life for each person living with Alzheimer's. Third, dementia training is offered at the ICA at a distance. In other words, it means that if you're in Bangladesh, you can easily take this training right from your home or your office. And if you're in a third world country, we do have humanitarian grants for those individuals that cannot afford to pay for membership or for the registration of the training, although many training offers are free. And so I want you to go visit the ICA to find out what suits you best. So we want to offer families and healthcare workforce in Bangladesh knowledge, systems, and support you so that you can increase the amount of time a person living with Alzheimer's is actually able to remain in their home, and decrease depression on the part of the care provider that is associated with such specialized care. The family caregiver or pack leader feels less isolation, feels less misunderstood, and is not left with grieving alone and in silence. The right to complete the cycle of care and life with their loved one must remain intact as possible and as long as possible. So finally, pack leaders or family caregivers must be allowed to take a more active role in the direct care of their loved ones when placed in long-term care, to further minimize the high costs of such care and to continue to be part of the larger interprofessional healthcare team. Not only is it necessary to maintain the highest possible quality of care and quality of life for those individuals living with Alzheimer's, but also to maintain the highest possible quality of work for the 3 care providers on average that takes care of somebody who is diagnosed with Alzheimer's. So here's your call to action. Now is the time to fill the need for breakthrough distance dementia care learning that is easily available to anyone who has a need and desire to acquire the necessary skills to sustain the extraordinary demands of Alzheimer's. It is a complex condition requiring specialized skills such as language, techniques, approaches, and a deeper understanding of the natural progression of Alzheimer's as we understand it today. Starting with medical schools, there is limited training offered for Alzheimer's, mainly because the medical community does not have one single cause or one single cure to offer their patients and the public. Nursing schools offer limited information to their students, and when they are released into the workforce, they too struggle to make sense of this devastating condition. It is not uncommon to see these professionals feel sorry for the families rather than be uplifting and supportive. Families are the first line of attack and care for their loved ones. They struggle every day for 24 hours, 7 days a week, to make sense of the condition, changes, challenges, and often medical procedures to be administered for which they are grossly undertrained to perform. Yet everyone is rushing around in circles, even desperate at times, to find the right dementia care solution, to find their way out of the Alzheimer's maze. PAC leaders or family caregivers must leave work early to provide emergency services to their loved ones, costing billions of dollars to industries and organizations. They also have to quit work entirely and prematurely retire in order to meet the high demands of the caregiving at home. All this becomes extremely costly to society in ways that are truly incalculable. Since it is impossible to look at the high emotional costs to families, more research will need to be performed to find how this condition comes to devastate families, healthcare workforces, budgets, the entire societies. The ICA recognizes the urgent need for a uniform dementia care training program driven by an alarming emerging increase in the diagnosis of Alzheimer's globally. The lack of proper services for care receivers and their families directly related to the lack of training and knowledge about dementia. Finally, there is a serious need for care social facilities to provide such specialized care, replacing the current medical rehab facilities. Taking action at this critical juncture of social, economic, and environmental drivers associated with dementia and social responsibility is at the heart of the ICA vision and mission. The ICA is committed to providing every healthcare professional and family a quality dementia care training program and encouraging interprofessionality and wellness for those living with dementia. To ensure we achieve our promise to you, Team ICA employs management techniques, policies, and procedures that support our motto, priming for cooperation to minimize resistance on the part of the care receiver. The International Caregivers Association, or ICA's, main goal is to invite everyone in the world, in Bangladesh, to adopt a uniform dementia care program that meets the most basic needs of all individuals living with Alzheimer's there. In addition to this main goal, it is our hope that the caregiver fatigue timeline can be greatly improved in order to extend home care for these individuals, providing daily care to someone living with Alzheimer's, and by providing essential dementia care training right in their home or in their office. To further support by Alzheimer's dementia coaching on demand. Since each and every situation is as different as each and every individual, people living with Alzheimer's or dementia do not lose their uniqueness. Those who provide for their care must hold that uniqueness for them when they forget what that is for themselves. They must also be able to remember for them and know that they are still alive inside. The ICA believes that each individual is sacred and must be treated with respect, thoughtfulness, and love. To that end, all the ICA training offers are designed to open their minds, the minds of learners, and increase the knowledge of those special individuals who have chosen to really provide such important and specialized care. At the same time, the ICA is very much aware of the enormous costs of this diagnosis to businesses and societies. To this end, the training also addresses ways for businesses and governments to cut healthcare costs, reduce worker absences, and to reduce personal stress on the healthcare workforce by providing them the knowledge and tools to work effectively and effortlessly. Hope is what everyone needs. The ICA is dedicated to acknowledging and encouraging societies, such as the Bangladesh Society, in creating acceptable care designs suitable for dementia care and staff homes and facilities with a well-trained dementia care workforce. Furthermore, the ICA foresees family caregiving being supported within a larger interprofessional healthcare team from the first day of the diagnosis. Most individuals living with Alzheimer's are cared for in their home or the home of a close family member, usually by their elderly spouse. ICA training will go a very long way in preventing loss of work, early nursing home placement, and early death of PAC leaders or caregivers, family caregivers. Early deaths in PAC leaders or family caregivers is estimated at 20 to 30%. Burnout is estimated at 80%. And there is also a drastic increase in suicides, homicides, due to the high stress leading to depression. 100% of primary caregivers and PAC leaders are never the same after caregiving for someone living with dementia or Alzheimer's. So the mission statement of the ICA is simply this. The mission of the ICA is to elevate the standards of dementia care through education and provide uniform services to all care receivers. Our vision is to support and augment knowledge in the practice of caring for those living with Alzheimer's at home or outside the home, for a fee or for free, no matter the nationality, language, color, religion, or creed of the care receiver. The ICA community desires to inform, educate, and provide the best possible set of tools to all care providers to enable the best possible outcome with the care of family members, residents, or patients living with dementia in any environment. Our guiding principles we have 3 of them. A well-informed and friendly healthcare workforce is essential. Number 2, an educated healthcare workforce generates the best possible care. Number 3, teamwork is the heart and soul of an effective healthcare workforce. Our philosophy at the ICA revolves around a simple idea: the universal need to support and augment knowledge in the practice of providing care to those with life-changing conditions and diseases requiring long-term assistance or care. Our philosophy is to connect elements of care and practice, confront and address problems in dementia care, encourage interprofessional healthcare teams to include family caregivers or PAC leaders, and help the profession of caregiving develop genuinely well-informed care professionals. So it is with great pleasure and enthusiasm that I am participating at a distance with you in Bangladesh this month in this celebration of your opening of a new facility to help those living with Alzheimer's. And thank you very much. Have a great celebration.